Well, thanks a lot for staying with us here on Sunrise Live on E on this Hope Day Wednesday. Now, lymphedema is a swelling that occurs generally on one of the arms or legs, and sometimes both arms as well as legs. Now, some patients might experience swelling in the head, the genitals, or even the chest. It results from a blockage in your lymphatic system, which is part of your immune system. So to talk more about the causes of the disease, we're joined in studio now by Dr. Marlin Mckay. Dr. Marlin, always a pleasure to have you.
Thank you, Faye. Thank you.
Now, we're looking at lymphedema, and for some of us, it might be even a new terminology that we've never heard of. We might have seen the symptoms, we might have seen signs of it, but we don't necessarily know what it is. So can you just take us through what exactly we mean by lymphedema?
Okay, so edema means fluid,
Okay.
and we talk about fluid buildup, and this is
Edema means fluid.
fluid.
Okay.
Edema, yeah. So it's buildup of fluid involving the lymphatic system. So we all know about our normal circulatory system, which is the heart and the blood vessels, the veins and the arteries. Now, running parallel to that is your lymphatic system. So this drains lymphatic fluid from the different tissues back up to your lymphatic system, to the lymph glands or the lymph nodes,
Okay.
and then into the tissues. So this is part of your body's army or defense force. You know, when you have an infection, a throat infection, your tonsils, those glands swell up here. So that's all part of your lymphatic system. So when,
Also, when you've got tonsils and your glands swelled up, that is the lymphatic system.
yes, that
Okay,
means
got
that
you.
it's part of your defense force. It's helping to fight that throat infection, as it were.
Okay.
So when there's a blockage in any of those vessels that drain this lymphatic fluid back up, that's when the fluid overloads and builds up in that part of your body. So if it involves your arm will swell up if it involves one of the legs. And I think the classic picture that usually comes to mind, just in terms of picturing what it could be, is elephantiasis. So that's
the
a
whole time we
drastic
speak about elephantiasis.
It's one of the causes.
Elephantiasis or titus?
Tiasis.
Tiasis.
Elephantiasis.
Yeah.
Yeah, not titus. So that's a classic picture, but that's an extreme case of lymphatic obstruction or lymphedema. But if you picture that, you'll know what we're talking about. So it's a blockage in one of those systems.
So that is one of the causes, and obviously when it comes to that, it's also the swelling of the head, right?
Yes, if there's
Or the
block to the
genitals.
drainage
Yeah.
system in that area.
Yeah.
So you get to in terms of classification, you get primary, where we don't know the cause. And this can happen in young people around puberty. All right, so they have some sort of genetic mutation in their lymphatic system that blocks the drainage, and so they have this congenital swelling or develops in when they start going to school. But the most common one is the secondary causes. Okay, so secondary causes, which means everything's normal but something goes wrong. So if you look at cancer patients,
You're scaring me. Everything's normal, but something goes wrong.
something goes wrong in the lymphatic system.
Okay.
So in other words, they weren't born with it.
Yeah.
All right. So if, for instance, cancer patients, when a cancer spreads out of the original site, it usually spreads to the lymph gland. So when you have surgery for cancer, they have to take out part of those lymph nodes, and therefore there's poor drainage. So an arm may swell up in the case of breast cancer. Infections such as those parasitic infections we mentioned about elephantiasis,
Yeah.
and then radiation. So cancer patients who have had surgery and now we have to do radium therapy to eliminate the rest of the cancer can also damage part of the
I've got
lymphatic
some
system.
visuals on the screen. I know that people on the screen can see some of this. Would this be like
So that's
sort of
a
like
classic case
symptom?
of, yes. So that's lymphedema, and you can see how the swelling just builds that leg up,
Yeah.
and it can be quite drastic.
Many of individuals with that need some form of surgery, and I'm saying that because just purely from a family perspective, I have a family member who actually has or displays the very same symptoms. So it's interesting to know that they go for surgery, etc. So what would
No. So what we're
happens
saying,
there?
surgery causes this.
Surgery causes this.
Surgery can cause this
Sure.
in the case of cancer surgery. So when
Yeah.
you're removing the cancer and removing the glands, this is the end result after the surgery, unfortunately. Once you have it, it's very difficult to cure. You see, because we've removed those lymph nodes, and so there's a psychological aspect you can see having one leg. There's we talk about taking care of the skin, because you can see it can ulcerate.
Yeah.
We talk about special bandaging that we teach the patients to do.
Okay.
You even have to go to a therapist, a lymphedema therapist, who can help to drain the fluid out of the glands. But there's not much that we do,
Okay, so then when we're looking at the actual treatment of it, because it sounds like it's almost like you need to be able to manage the disease more than cure it. It's more of managing it.
Yeah.
So you speak about draining of the lymph nodes, and then what else can I do?
Okay, so you have to take care of the skin.
Okay.
In other words, nourish it, make sure there's no infections, don't scratch it, keep your nails short, don't. Be careful of causing a wound
When
to
you
there.
say that don't scratch it, does that mean that it gets itchy
It can
from time
itch
to?
because of the dryness and the poor
I
circulation. So
see,
you don't
yeah.
want anyone to scratch it. You don't want to bump it and cause an infection there. Then we talk about the doctor will refer you to a special therapist who is trained in the management of this, and they do special techniques using their hands to try and drain out the fluid from the tissue.
Okay, now help me out now. When it comes to the head swelling, or when it comes to the genital areas swelling, what kind of help is there? And I'm saying this because, I mean, we've got various questions coming in, and we see Mxolisi, Vuyo, as well as Chimwemwe, who also posted some of the questions regarding lymphedema on Facebook. So we have noticed some of those questions. Hopefully we've touched on it with Dr. Marlin here. How then do you start treating those areas?
Yeah. So fortunately, those are not as common. The most common areas would be the arms and the legs.
Yeah.
All right. If it involves the testicular area, it's usually as a result of this infection, elephantiasis. And there are antifungal, antiparasitic, like antibiotics that
Okay,
one
now you
can
can
use. So
take me through this
medication.
just from grade 1 here. Elephantiasis, right? It actually causes lymphedema, or which way is it?
Yeah.
Elephantiasis
Elephantiasis is
causes
an infection,
Yeah.
and this worm gets into your lymph vessels
Yes.
and blocks it. So it's a cause.
Got you.
So
Follow me.
therefore, to treat it, you have to treat with antibiotics, special medication that can kill off the worms and then unblock it. All right. Unfortunately, patients present. It's a rural disease. Patients present very, very late, and there's a lot of already extensive damage to the lymphatic vessels. But most of the treatments involve supportive. Surgery is not very successful in this lymphedema, and so we have to manage it with bandaging, drainage, using your hands, and psychotherapy, physiotherapy, and all these sorts of things.
Okay, now take me through in terms of the beginning stages, because I'm sure there is a beginning stage before it progresses to the point where you've got extreme swelling,
Yes.
right? So then how will then we be able to determine whether or not I actually am displaying some form of symptoms of lymphedema? Would it be like a redness? Will it be an itching? Will it be like a slight swelling? How will I know that, hey, there's a serious problem that I need to be aware of?
Okay, so interestingly, I had a mum and daughter within 2 days that presented out of the blue. Just walked into the surgery doctor. The mum actually thought she had bought a pair of shoes that were faulty or didn't fit her well,
Yeah.
because just literally by the afternoon she just developed swelling of the legs.
By the afternoon?
By the afternoon,
Sure.
painless,
Yeah.
felt nothing, no issues, nothing on the skin. So that was primary lymphedema, where it just happened, probably on a genetic basis. She had inherited something. Okay. In the other case of secondary, where there is already a cause, something precipitated, something went wrong, such as you have cancer, surgeon takes you to theatre, has to drain out part of the gland, such as breast cancer, and then you are prepared for it, because the surgeon will tell you, listen, we are taking out the glands, you may have the complication of swelling of the arm, but this is how we're going to manage it.
Yeah.
And so you start being prepared for it. In the case of infection, absolutely pain, redness, swelling, inflammation, skin changes on the outside,
Sure.
so you can see it. So you have to visit your doctor and get it assessed and diagnosed properly.
The sooner you can get to a doctor, the better it will be. Now, Dr. Marlin, you know that this part of the show, we also get to have people ask you different questions related to all health matters concerned. So I'm going to bring in Penny here in the conversation, and just to see exactly what people are saying on Facebook. Penny?
Most definitely. I've been cooking up the stuff in the kitchen. I'm kidding. We asked them to ask the questions. May I?
Come sit.
Yeah. Ask them to ask the questions on Facebook. So, Dr. Marlin, some of the questions are very interesting. Like Shadrach Mboweni says, 2 liters of soft drink a day every day. How bad is the damage, and to what exactly?
It's very, very bad. I assume he's talking about a sugar-sweetened beverage,
Yeah.
right?
Yeah.
So 1 liter is at least, let's take it a cup. 1 cup of a sugar-sweetened beverage, 7 to 8 teaspoons of sugar. So 1 liter takes 4 cups. So 8 times 4 is 32, times 2, that's 64 teaspoons of sugar. Next question.
Next question.
We need a...
Okay. What's the main cause of sugar diabetes?
Okay, so sugar diabetes is a background. You have a background of family history. We're talking about type 2 diabetes. Background of family, someone in your family has diabetes. You are overweight and you don't move your body. Put those 3 things together. So overweight, no exercise, sedentary lifestyle, family history of type 2 diabetes, you are at great risk of developing. So there's no one single thing that goes wrong.
Okay. So now, Mulifi here, this one is in Sotho. Hi, Sale Kentalino Makalong a January. Le kajeno ha ke so fole, e ka ba ke eng? Okay.
Or can I please translate that? I actually understand. So what he's saying, Dr. Marlin, is that he removed his tooth in the beginning of January and still today he is not healed. So do we have any form of causes? Is there an infection or anything? How did I do?
Very good.
I know. Give me 5. Yes.
Okay.
So what happened?
So a non-healing after removal of a tooth is most likely a persistent infection in that dental cavity. So he needs to go back to his dentist, especially if there's pain, swelling on that affected side. There is usually an infection. So please go back. You may just need a course of antibiotics.
Sure.
Okay, so Zanele says, hi doc, my question is my left boob is very painful, but it doesn't have the lump. What causes that?
Okay, so when you have pain, pain usually indicates inflammation. So there may be an infection going on there. There may be a blocked duct that's causing buildup, and that's why it's painful or swelling. The good news is that cancer, breast cancer, generally the lump is not painful. So if you have pain, it's probably just more of an inflammation. But rather have it checked out. We can do a sonar and see where the problem could be.
Okay. So
Well done for checking the breast.
that's asking the doctor. There's so many of these questions. I mean, we wish we could take all of them, but unfortunately
We should sit down and ask you all these questions, especially around the sugar issue. He just gave me heart palpitations there. But Dr. Marlin, thank you so much for joining us this morning, shedding some light on all health matters.
Yeah, most definitely. So keep those questions coming, and next time I'm sure Doctor will tackle some of them as well, more of them as well. So stay with us. Sunrise Live on ETV.